So rhinoplasty is an operation that changes the shape of the nose, and it's very closely related to septorhinoplasty. So without going into too much detail, the rhinoplasty part of it is mostly about the external structure of the nose and changing the shape and position of the bones and also the tip of the nose, which is cartilage. The septo part of the septorhinoplasty involves changing the position of the septum, which is the partition inside the nose, and that divides it into two sections. So I more commonly perform the full septorhinoplasty operation, operating on all aspects of the nose, rather than just rhinoplasty. And the intention is to improve appearance, but also improve function. So there's a lot that can be done in the septorhinoplasty procedure, and it's very much tailored to the needs of the patient from both a functional and a cosmetic point of view. And my job, most importantly, is to be able to tell the patient what is reasonable and feasible, and what I think will work best for the patient. So rhinoplasty is performed in two main ways. They're called either the open or the closed approach. So the open approach involves a surgical incision in the skin just between the nostrils in the area known as the columella. And this allows the surgeon to lift the skin up and then have full access to all the structures, both bone and cartilage, under the skin. And then the operation can proceed depending on what is necessary. And this allows the surgeon to do the full range of techniques. Now, the closed approach involves smaller incisions made inside the nose, um, and a lot can be done via this approach, but perhaps not quite as much. So the pros and cons are the closed approach is less aggressive, perhaps, and there's less cutting, and healing can be a little faster, but you can't do as much. And so it's the surgeon's job to decide which approach is better for the individual patient. And as with many things in surgery, different surgeons will have different opinions on what they feel is better. So, personally, I would always advise on what I think is going to be better in my hands, and patients usually accept that. Now, complications, there are a number. So, as with any operation, there's a risk of bleeding and there is a risk of infection. If the open approach is used, then there is a small risk of pore scarring in that skin cut. That's actually quite a rare complication, and normally it does heal up very well. Um, the other risks that there is about a 1% risk, or perhaps a bit less than that, of a perforation, so a hole through the septum. That's an internal effect, and nobody would see it, but it can cause symptoms such as crusting, itching, bleeding, and it can be quite frustrating. Now, it's the kind of thing which usually could be repaired, but that's, of course, another operation which the patient doesn't want. And then the other risk, which I always stress greatly, is the potential for cosmetic changes which aren't entirely what was expected. So, cosmetic dissatisfaction. And that can be in 5 to 10% of patients, certainly if the main aim is for a cosmetic improvement. And some of those patients will want to then go on and have another operation. So any patient having rhinoplasty needs to be aware of this possibility, as it is sometimes very hard to get everything right in the first operation. And then you also asked about recovery. So most patients will require definitely a week to 10 days resting off work and not doing very much. Some patients require 2 weeks off work. At that point, they can go back to relatively normal activity. And I normally advise my patients that they can start to carry out light exercise and then build themselves back up as they feel able to do so. But certainly, they mustn't engage in anything where they might be at risk of being hit, because the nose would be very painful if it got hit. But also, it's quite weak and that applies for about 3 months. So if they got knocked, it'll hurt, but it will also potentially damage all the work that's been done. And then in terms of longer term recovery, so by about 3 months, a lot of the healing has happened. And I normally say perhaps 60, 70% of the healing has happened. And then the rest of the healing is gradual over the next few months, usually taking up to about a year. So it's a very long process, and there'll be changes in the shape and the function of the nose throughout that time. And patients do need to be aware of it. But as long as they are forewarned, then most patients accept it and they're fine, and then they can get through that journey, because it is a journey, very well. Absolutely. So as I alluded to in an earlier answer, if it's a septorhinoplasty, so that's operating on the full structure of the nose, then yes, the operation can be very good for improving nasal function. And this is something that I do very frequently, both in my NHS and private practice. And the key element to this, to doing a good operation, is understanding the anatomy of the nose and how all the structures should be positioned, and trying to recreate that through various techniques to correct the deformity, whether it's something that you're born with or something that's acquired through an injury, or sometimes it's just been a developmental issue as the facial growth happens in early childhood and in puberty. Sometimes there can be asymmetry, and this can lead to deformity and therefore nasal obstruction. So there's lots that we can do, and septorhinoplasty is very effective for this. The kind of surgeon that you want for rhinoplasty is someone that dedicates a lot of their time to operating on the nose and doing functional and cosmetic operations. It's a very complicated area, and certainly, in my opinion, only someone that spends most of their time in the nose can be truly expert. So that's the first criteria. Um, it's then also helpful to look at review websites such as Top Doctors, so that you can see that this person has a good track record and patients are usually satisfied with the surgery and the service that they have received. Once you've decided to go and see somebody, then it's good to uh, build up a good rapport with your surgeon, and you as the patient need to feel confident in his or her ability. And if you don't get that feeling, and you don't particularly get on with them so well, then it might be that that's not the right person for you. Um, then in terms of asking what questions should you ask, you need to be able to tell them what you want. So if it's a cosmetic operation you're going for, then you can tell them this is what I'm unhappy with, and you need to ask them to give you options for how to correct the problem, perhaps show them pictures where you could have the images morphed through clever programs, and then you can ask the surgeon to create an image that will be which will be the aim of the surgery. So it's also good to ask the surgeon about complications and what they see as their complications, and ask them about the recovery period, and then you can also talk about specifics of what happens on the day. So I think those are the main things that you need to discuss. And hopefully by the end of it, you will have that feeling that the surgeon understands you, they understand your problem, and they've given you good options for how to solve that problem through the rhinoplasty operation. Non-surgical rhinoplasty is quite a popular option, certainly in the last few years, and there's a lot of clever ways of doing it. Mostly, it's using filler to camouflage or mask deformity in the nose, and if done well by an experienced practitioner, then this can be very effective. The pros and the cons to non-surgical rhinoplasty is that it doesn't last forever. So if the filler that's been injected isn't quite right, then it will dissolve eventually and the problem goes away. But on the other hand, if you really like the appearance, then you'll have to have it done again. Sometimes, if you've had filler put into the same place 2 or 3 times, then it can create some localized scarring and then form a more permanent change, and this can be a good thing. So I'd say that non-surgical rhinoplasty is certainly a valid approach as long as the patient is fully informed as to the pros and cons. And they're having whatever procedure done by an experienced practitioner who knows what they're doing and is experienced in using these techniques in the nose and face.